afternoon everyone. My name is Gaikwad. I am role number 22. My today's topic is inguinal hernia. So what basically hernia is? Hernia is the protrusion of the abdominal contents from the abdominal wall. It can be external as well as it can be internal. So majority of the hernia of our body are accounted to the abdominal region, of which specifically the inguinal region, and inguinal hernia accounts for about 75% of the hernia of our body, and hence this region and this hernia is surgically of a great importance. So before going to the main topic, the inguinal hernia, we will first discuss the two subtopics, which is the inguinal canal and the apex triangle, which is necessary to understand the inguinal hernia. So coming to the inguinal canal, the inguinal canal is an intermuscular passage. It has two openings, which is the deep inguinal ring and the superficial inguinal ring. The deep inguinal ring is posterior and is oval opening, and the superficial inguinal ring is a conical gap. Now coming to the apex triangle, also known as the inguinal triangle. This is our rectus abdominis muscle. This is the pubic crest. This is the anterior superior iliac spine. This is the inguinal ligament. Here, this is the inferior epigastric artery, and also a medial umbilical ligament runs here. So this is the apex triangle. Its medial boundary is formed by the lateral side of the rectus abdominis. Its lateral boundary is formed by the medial side of inferior epigastric artery, and its base is formed by the lower half of the inguinal ligament. And this medial umbilical ligament, it divides the apex triangle into two parts: the lateral part and the medial part, which is necessary to understand the direct inguinal hernia, which we will see further. Now we will see a comparative chart to understand it more easily. First, now the inguinal hernia. The inguinal hernia specifically is the protrusion of the abdominal contents, for example, the loop of intestine, into the abdominal cavity. It is mainly of two types. The first is the indirect, and the second is the direct. So the inguinal hernia is first mainly divided into two types: the indirect inguinal hernia and the direct inguinal hernia. Coming to the indirect inguinal hernia, it is caused due to the protrusion of contents. The contents come out into the inguinal canal through the deep inguinal ring. This is mainly caused in the children and young age adults, which is the congenital and the acquired. The congenital indirect inguinal hernia, it occurs because there is it is complete or incomplete patency of the tunica of the processus vaginalis, and the acquired inguinal hernia occurs when there is increase in intra-abdominal pressure during the activities like heavy muscle weight lifting. Coming to the direct inguinal hernia, the direct inguinal hernia occurs when the contents are pushed back by the posterior wall of the inguinal canal. This is also of two types, depending on the division of the apex triangle. It is of two types. Firstly, it is the lateral, which occurs in the lateral part of the apex triangle, and the second is the medial. Now, the medial part of the apex triangle is supported by the conjoint tendon, but lateral is not supported by the conjoint tendon, and hence the direct inguinal hernia are more common in the lateral part of the apex triangle. Now let's just sum up our main topics, which is the indirect inguinal hernia and the direct inguinal hernia. Let's consider the first factor, which is the site of protrusion, which is the deep inguinal ring for indirect, and posterior wall of inguinal canal for the direct hernia, direct inguinal hernia. the indirect inguinal hernia is of pear shape and the direct is globular shape. Now, third point, we will discuss the affected age groups. The indirect inguinal hernia is more common in children and young age adults. The direct is more common in mature adults and old people. Fourth is the nature of the hernial sac. Hernial sac, here it is narrow and here it is wide. Coming to the extent, the indirect inguinal hernia is scrotal and the direct is not scrotal. Next point is direction. The indirect inguinal hernia is downward, forward and medial and is oblique in shape. But the direct inguinal hernia is just straight and forward. Now coming to the test for hernia, coming to the correction. The indirect inguinal hernia is usually not correctable. It's sometimes irreducible. And direct inguinal hernia is always reducible. The last independent test for hernia, internal ring occlusion test is internal ring occlusion test, which is positive for the indirect inguinal hernia and negative for the direct inguinal hernia. So what basically the internal ring occlusion test is, so after the correction, after the reduction of the hernia, when we ask the patient, when we apply the pressure over the deep inguinal ring and ask the patient to cough, if the hernial contents come out, then it is the direct inguinal hernia because it happens in the nasal triangle. But if the abdominal contents does not come out, it is the indirect inguinal hernia. Thank you.